There are a lot of exciting new cosmetic treatments in 2025. Now, I'm a real plastic surgeon, and on this video, we're gonna count down my 5 hottest new cosmetic treatments for the new year. Whether you're curious or considering getting something done, this list has something for everyone. So let's dive in. Kicking off our list at number 5, the Motiva breast implant. Now, these are being touted as the 6th generation of silicone breast implants, and they were FDA approved just last year in 2024. So what makes them special? Well, first, they have a nano-textured silk surface that's smoother than traditional textured implants. Plus, the advanced silicone gel inside interacts with the specialized shell to reportedly make them feel and look incredibly natural. They also come with a built-in radiofrequency identification device. Now, this means that you can scan the implant to determine its type. I mean, that is quite futuristic. Well, studies also show that they have a much lower risk of capsular contracture, 0.54% compared to the 2 to 20% we see with the other implants. Now, capsular contracture is the most common complication of breast implants, so this lower contracture rate is a big deal. But here's why I'm being cautious. These are long-term devices, and while no cases of ALCL, anaplastic large cell lymphoma, have been reported yet, the studies only follow patients for 3 to 5 years. ALCL is a rare type of cancer associated with textured breast implants. Now, these Motiva implants aren't as textured as the other implants, but they're also not technically smooth either. So do they come with a risk of ALCL? Well, we don't know yet. So for now, I'm playing it safe until we have a bit more data. Coming in at number 4, we have PRF, or platelet-rich fibrin. If under-eye hollowness is a concern for you, this just might catch your attention. Well, PRF is a step up from PRP, or platelet-rich plasma. The main difference? Well, the spinning process is slower, resulting in the PRF being thicker, and this makes it supposedly ideal for filling those hollow areas under the eyes. While traditional treatments for this issue, like hyaluronic acid fillers, can lead to lumpiness, while fat grafting can be unpredictable. So PRF offers a natural alternative, but there is a downside. You will need monthly treatments for several months to see results. So here's my take. I'm not convinced that it's a true filler just yet. It kind of reminds me of self-fill from back in the day when PRP was advertised to fill, but technically didn't. So, does PRF actually fill even though PRP doesn't? Some doctors are claiming this, but I'll be waiting to see if this one actually does what these doctors claim, or if it basically fizzles out. Next, at number 3, is the Deep Plane Facelift. You've probably seen this all over social media, where surgeons are calling it a revolutionary approach to facelift surgery. So what is it? Well, unlike traditional facelifts, which lift the skin and the muscles separately, this technique elevates them together as basically one unit. The result is that plastic surgeons who perform it claim that they're longer lasting in their outcomes, they have better scars, and even have a more natural appearance. But here's the reality. While it's been around for over 20 years, it was first described by Dr. Sam Hamra and was called the composite facelift. It's basically gained new life as a bit of a trendy marketing tool. Surgeons love to tout their expertise with it because it's a complex surgery that is difficult to learn and can command high prices, even over $100,000 in places like New York. However, the risks are real. Because the dissection goes near the branches of the facial nerve, there's a higher chance of motor nerve injury, where some of the muscles of your face can become temporarily or even permanently paralyzed. So for me, I'm sticking to my less invasive technique that heals quickly, delivers great results, and has fewer risks. And these before and after photos show some of my facelift results. But that being said, if your plastic surgeon is an expert at the deep plane facelift, chances are you'll get a great result. You just don't want someone doing a deep plane facelift on you if they're just dabbling in the operation or trying it out for the first time. At number 2, we've got one of the most buzzworthy treatments from South Korea, Regeneron, also known as the salmon sperm DNA facial. Well, Kim Kardashian reportedly underwent this treatment not that long ago. So yes, it sounds unusual, but here's the science. Salmon sperm DNA contains polydeoxyribonucleotides, and these act as biostimulators. They help your skin produce collagen, reduce inflammation, and even boost hydration. So how do they get the sperm out of the salmon? Does someone sweet talk them in a dark room? Well, I'll let your imagination figure that one out. Well, right now you need to travel to Korea for Regeneron injections, as it's not FDA approved for that use in the United States. That being said, some practitioners in the US are applying it topically after microneedling, and the idea is that it can seep into those microchannels created by the needles to deliver the benefits. So will we get FDA approval for salmon sperm injections this year? Maybe. Now, currently there is no treatment like it in the United States. So if it gets approval, I predict that it's going to be a super popular treatment. And this is one trend to definitely watch out for. And finally, the #1 hottest trend for 2025 is exosomes. Now, these tiny packets of information, traditionally created by stem cells, are being touted as the future of skincare. Exosomes are already being used topically to speed up the healing after procedures like lasers, chemical peels, and microneedling. They're said to boost collagen production, to reduce inflammation, and even to help wounds heal faster. So what is next for exosomes? Well, once exosomes get FDA approval for injection, the possibilities are truly endless. But for now, I'm testing an exosome-based skincare line, and I'm honestly very excited to see how it performs. Could it reduce redness, wrinkles, and inflammation? I'll be the first to let you know. Now, while I don't think that exosomes will replace classic effective skincare ingredients like retinol and vitamin C, they could definitely amplify their effects. So the sky's the limit for exosomes. So these 5 treatments may be the future of cosmetic and anti-aging medicine, but what is the present? On this video, I reveal the 5 anti-aging treatments available today that even your doctor may not know about, but you should. Check it out right up here, and remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.